The United States is in the midst of a widening physician shortage. In order to bring light to this problem, Staff Care, a company of AMN Healthcare, established the National Country Doctor of the Year Award. Staff Care is the nation's leading provider of temporary physician staffing services, including rural areas where the physician shortage is particularly acute. The Country Doctor of the Year Award is Staff Care's way of highlighting the spirit, skill, and dedication of the outstanding rural physicians. The award is also intended to inspire young doctors to embrace the challenges and rewards of rural medicine. Since 1992, Staff Care has honored some of the most inspiring country doctors in the United States, such as Dr. Elton Lehman, who built a birthing center to accommodate the special cultural needs of Amish women. Dr. David Nichols, who flew his helicopter once a week to tiny Tangier Island in the Chesapeake Bay to care for its isolated population. And Dr. Robert Basel, who took out a second mortgage to build a clinic for his patients when the local hospital closed. Joining this tradition is Dr. Van Breeding of Whitesburg, Kentucky.
So it's great to be here today with all my friends to celebrate this award with not just me, but with you all, because there's no way that you can be a country doctor unless you have people like you all to support him, to bring him through this, to mentor him, to grow him in this community. So the thank you for this award is not just from me, it's from the whole community, from Mount Comprehensive Health Corporation, from ARH, from UK Healthcare, from my friends at Carcassonne, at Cowan Creek, from all over Letcher County, from the Kentucky River Valley, from the Cumberland River Valley, where we have our clinics.
Come girl, walk away. Come girl, ain't my home, I'm gonna leave.
Dr. Breeding is a high energy type of person. He is very devoted to his faith, his family, his patients, and the community, and he is a tireless individual, working many hours every day while the rest of us are sleeping. He's still at it. I start getting texts from him in the morning by about around 5 o'clock, and I think even at that he's let me sleep in.
I like to get up early and get started because, you know, I feel by the time I've got my hospital rounds in and took my walk, I've got what most doctors do in the whole day already done. But I believe that to be a country doctor, you got to be able to take care of the whole patient, anywhere they're at. My patients rely on me to take care of them at the clinic, take care of them at the hospital, and take care of them at the nursing home. And rehab, we have a rehab facility too. We do have a busy practice and a busy day, but it's also, when they come back to the clinic from the hospital, I know what's going on with them because I was the one taking care of them. And when they go from the clinic to the hospital, it's easier for me because I know what's going on with them at the clinic. I don't have to hand that off to another doctor to take care of them. My knowledge of my patients is vast because I'm dealing with them all the time. The other thing is that in a small town, you know everyone. And so I know everybody here and kind of know where they live and kind of what's wrong in their family. And somebody tell me who they are and who their family is, you know, I kind of know what their past medical histories are and what the risk factors are. So really, I've got a leg up on everything going on.
I was telling him you're the only doctor I see.
It's the only one you've ever been to, I think. Yeah. She started coming when I first come to Whitesburg back in '91. It's been here a long time. Now, you want to take a look in your throat? Just open it up for me. Yeah.
Well, he keeps checking on my cholesterol, my heart problems, and arthritis. And well, in my book, he's a great doctor. Yeah, a real curing doctor, and he does. If he finds a problem, he tries to get to the bottom of it. So
130 over 78, so blood pressure's perfect there.
okay.
So good blood pressure.
There's a lot of barriers to healthcare, and that barriers are seen all over the United States. So transportation is an issue here that in a big city they have, you know, buses and trains, and we have to work around that and create ways to get people into the clinic. Access because of lack of insurance, financial because of cost of medications and the cost of ER visits. So these obstacles have been made worse because as coal has declined, so has the ability to reach patients and to have facilities open to see them, because the money is gone, the jobs are gone, people have left, and so there's not as much need as there was before when coal was booming and there were lots of jobs and lots of insurance and patients were able to come and get health care. So we face a lot of unique barriers here, but we overcome them with unique solutions that we try to arrange. The opioid epidemic was supposedly born in East Kentucky, although we're not the birthplace that we recognized it first. We're working aggressively with a program here in our area right now. We're working with the Needle Exchange Program, with addiction recovery, to create centers to be able to get people off drugs. By creating a funding mechanism, we were able to buy $8 of food per family member for the eligible families who had chronic illnesses or who were pregnant or were children, and that provide them with fresh fruits and vegetables. It helped control their dietary issues as far as being overweight or having high blood pressure or diabetes, but also helped give ex-coal miners jobs producing the food. It shows how in a community small like us that we can create a solution for one problem and use it also to be a solution for another problem in the town. You know, there's nothing that can reward you more than having a high school friend that you send for a colonoscopy that has cancer and has to take it early, and it's treated and cured without having major surgery. I see something like that every single day. I hate taking a day off work because I'm afraid that we're going to miss that opportunity to take care of that folk. We try to be a part of the community and be a good citizen too, and if you stay active in that, it's just a lot of fun. You know the people coming in and they appreciate you and you appreciate them, and people are all the time thanking us for what we do for them, but I thank them for giving us the opportunity to work with them and listen to what we have to say and making a difference in their lives. And they reward us with all kinds of good foods and home-cooked things and becoming healthier. That's the biggest reward, seeing people actually achieve long-term health, and that's the remarkable part.
Okay, come right out here with me and we'll get you all set.
All right.
My goal and Mountain Comp's goal is to use this opportunity to make sure that we are able to deliver the best health and best health care to our patients.